An enlarged prostate, what it is and how to treat it. An enlarged prostate, or BPH, benign prostatic hyperplasia, is a common condition that affects millions of men, especially as they age. If you're unfamiliar with the term or its symptoms, here's everything you need to know about this common prostate problem. What is an enlarged prostate? An enlarged prostate, or BPH, benign prostatic hyperplasia, is a common condition that affects millions of men, especially as they age. If you're unfamiliar with the term or its symptoms, here's everything you need to know about this common prostate problem. The basics. The prostate is a gland that grows as men age, so many have an enlarged prostate by the time they reach their 50s. Symptoms include urgency, frequency, and incomplete bladder emptying after urination. Doctors may use ultrasounds or rectal exams to diagnose an enlarged prostate. Treatment can range from non-invasive procedures such as watchful waiting and minimally invasive surgeries like transurethral resection of the prostate, TURP, or a radical prostatectomy. A little bit about anatomy. The prostate is a small, walnut-shaped gland that sits below the bladder. The prostate squeezes against the urethra in order to release semen during ejaculation. Urine flows through the urethra past the prostate, before it enters the bladder. Causes. An enlarged prostate occurs when the tissue of the prostate gland grows bigger than normal. There are several factors that can contribute to this, including increased age, heredity, prostate cancer, benign prostatic hyperplasia, BPH, and alcoholism. Symptoms. The following are the most common symptoms of an enlarged prostate. It can be painful when urinating or ejaculating. You may notice a change in your urine flow, with some difficulty when urinating or straining to pass urine. Peeing frequently is also a symptom, but you may not be able to relieve yourself fully when urinating, which could cause bladder infections. Risk factors. The risk factors for enlarged prostate include being older than 50 years old, family history of prostate enlargement, and/or a history of benign prostatic hyperplasia. Other causes include excessive alcohol consumption, lack of exercise, smoking cigarettes, diabetes, or high cholesterol. When should you see a doctor? If you have urinary symptoms, such as difficulty urinating or a persistent need to urinate, it is time to see your physician. There are also other symptoms which can be associated with an enlarged prostate, including blood in the urine or semen. You should also see your doctor if you feel pain during ejaculation or sex, there is no urine in the stream when you pee, your bladder empties only small amounts at a time, or when the flow of urine diminishes. Diagnosis. The prostate is a gland in the male reproductive system that is right below the bladder. You will often see this gland as a man walks. The prostate gland makes fluid that protects sperm from the acidity of urine. While most men have an enlarged prostate, it can be a serious health concern if it becomes so large that it presses on nearby organs. Left untreated, the prostate enlargement can lead to urinary difficulties or problems with getting an erection. Treatment options. An enlarged prostate, also known as benign prostatic hyperplasia, BPH, is a common disorder in men. Men with an enlarged prostate may experience urinary flow obstruction, frequent urination, nocturia, getting up at night to urinate, lower urinary tract symptoms like painful urination or urgency, and more. There are two types of treatment for an enlarged prostate: medical therapy or surgery. FAQ. What is an enlarged prostate? An enlarged prostate, also called benign prostatic hyperplasia or BPH, can cause a range of unpleasant symptoms such as trouble urinating, urinary incontinence, the need to get up frequently at night, the feeling that you have not completely emptied your bladder, painful sex, increased risk of getting a urinary tract infection. How does it affect my prostate? BPH enlarges the prostate by making its tissues larger. Thank you for watching. Please subscribe.